What if a medication you take every day for something as common as trouble sleeping, chronic pain, or even managing your diabetes could be silently increasing your risk of heart failure? Many of us take these medications, both over-the-counter and prescription, trusting they're entirely safe for long-term use. But what if that assumption is wrong? Welcome to the channel. I'm a medical doctor in the UK, and in my practice, I see patients every day who are trying their best to manage their health conditions. But a critical part of managing your health is understanding not just the benefits of your medications, but also their potential risks. Heart failure is a serious condition where the heart muscle can't pump blood as well as it should. It affects millions of people, and the numbers are growing. While we often think of things like heart attacks or high blood pressure as the main causes, the story is more complex. In this video, we're going to break down the surprising connections between three very common types of medication and the risk of developing heart failure. This is information that every patient taking these medications or considering them needs to understand. We're not just going to talk about the problems, we're going to discuss what you need to look out for, and most importantly, what you need to discuss with your own doctor. This is about empowering you with the knowledge to be an active partner in your own healthcare. Let's start with our first and perhaps most surprising item, melatonin. Melatonin is a hormone your body naturally makes to regulate sleep. The synthetic version is incredibly popular, available over the counter, and used for everything from jet lag to chronic insomnia. Many people believe that because it's natural, it must be completely harmless. This has led to widespread long-term use without any medical supervision. However, brand new research is challenging this assumption in a very serious way. A preliminary study presented at the American Heart Association's Scientific Sessions in November 2025 has uncovered a concerning link between long-term melatonin use and heart failure. Let's be very clear about what researchers found. In a large review of health records from over 130,000 adults with chronic insomnia, those who used melatonin for a year or more had about a 90% higher chance of being diagnosed with new-onset heart failure over a 5-year period compared to those who didn't use it. The study also found that long-term users were almost 3.5 times more likely to be hospitalized for heart failure. Now, it is absolutely critical to understand what this means. This study shows an association, not definite causation. This means we see a link, but we can't yet say for certain that melatonin directly causes heart failure. It's possible that people with severe chronic insomnia have other underlying health issues that contribute to heart risk. However, the connection is strong enough that it has sent a major signal to the medical community that long-term melatonin use may not be as benign as we once thought. As one of the lead researchers stated, melatonin supplements may not be as harmless as commonly assumed. The exact reason for this link is still being investigated. But the bottom line is that a potential 90% increased risk is a signal we must take seriously. So, what are the warning signs you need to look for? I teach my patients a simple framework to remember the key symptoms of heart failure. It's called SWAIT. S is for shortness of breath. This isn't just feeling winded after a workout. This is breathlessness from simple activities like walking up a flight of stairs or feeling short of breath when you lie down flat. That extra fluid can back up into the lungs, making it hard to breathe. W is for weight gain. This is rapid, unexplained weight gain, like gaining several pounds in just a few days. This isn't fat, it's the accumulation of excess fluid. E is for edema, the medical term for swelling. You might notice it in your legs, ankles, and feet. Maybe your socks leave deep indentations at the end of the day. This is a classic sign of fluid retention. A is for abnormal fatigue. This is a profound sense of exhaustion that isn't relieved by rest. Your organs aren't getting the oxygen-rich blood they need, leading to deep, persistent fatigue. T is for tachycardia, or a rapid heartbeat. Your heart may start beating faster to try and compensate for its weakened ability to pump blood. So, what is the actionable advice here? Given this research is new, official guidelines haven't changed. But as a clinician, My advice is to practice caution. If you've been using melatonin every single night for a year or more, it's time to reevaluate. First, don't panic and don't stop it abruptly, as this can make your insomnia worse. Instead, see this as a reason to have a proactive conversation with your doctor. Discuss this new research. The current thinking is that melatonin is generally safe for short-term use, a few weeks or maybe up to a couple of months. Long-term nightly use is where this new potential risk has been identified. Talk to your doctor about a deprescribing plan. Could you switch to using it only on nights you really need it, rather than every night out of habit? More importantly, this is a great time to explore safer, non-drug alternatives for improving your sleep. This is what we call sleep hygiene. This includes maintaining a consistent sleep schedule, creating a cool and dark sleep environment, and avoiding caffeine and screen time before bed. These behavioral changes are the cornerstone of treating chronic insomnia and are far safer for your long-term health. Next, let's discuss a class of medication almost everyone has in their home: non-steroidal anti-inflammatory drugs. This includes ibuprofen, naproxen, and many others, available both over-the-counter and by prescription. They're the go-to for headaches, muscle aches, arthritis, and fever. Because they're so easy to get, it's natural to think of them as harmless, something you can take for weeks or months without a second thought. But it's this long-term, chronic use where hidden dangers for your heart can begin to surface. So how can a simple pain reliever lead to something as serious as heart failure? It comes down to how these drugs work and their unintended effects on the body's delicate fluid balance. Non-steroidals block enzymes that produce substances called prostaglandins. This is great for fighting pain, but not so great for your kidneys. Your kidneys rely on those same prostaglandins to help regulate blood flow and, critically, to get rid of sodium and water. When you take non-steroidals consistently, you block this process. As a result, your kidneys can't excrete sodium as efficiently, and where sodium goes, water follows. This leads to fluid retention. Your body starts holding on to extra salt and water, increasing the total volume of blood in your system. Now, picture your heart as a pump. If you suddenly increase the amount of fluid it has to pump, you're making it work harder. For a healthy heart, this might not be an issue short-term, but for someone with underlying risk factors like high blood pressure, kidney issues, or older age, this sustained extra workload can strain the heart muscle. Over time, the heart can struggle to keep up, leading to the development or worsening of heart failure. This fluid retention can also directly increase your blood pressure. Studies have shown that non-steroidals use can raise blood pressure, putting even more stress on the cardiovascular system. It's a double-edged sword. The drug that's relieving your joint pain could be silently contributing to fluid overload and hypertension, two major drivers of heart failure. This doesn't mean you should immediately stop your medication, especially if it's prescribed. Abruptly stopping can lead to uncontrolled pain. The right move is to have an open conversation with your healthcare provider. Schedule a medication review. Discuss the risks versus the benefits for your specific situation. Ask about your personal risk. Do you have high blood pressure or kidney disease? Are you over 65? These factors increase your risk. Finally, ask about safer alternatives. Could acetaminophen be an option? What about physical therapy or other non-medication strategies? The goal is always to use the lowest effective dose for the shortest time possible. By the way, if you're finding this information valuable, please take a moment to subscribe to this channel and turn on notifications. My goal is to continue providing clear, evidence-based medical information that helps you stay informed and healthy. Your support allows me to create more content just like this. The third class of medication on our list is used to treat one of the most common chronic diseases in the world: type 2 diabetes. These drugs are called glitazones. The two main drugs here are pioglitazone and rosiglitazone. They are oral medications that help control blood sugar by making your body's cells more sensitive to insulin. And while they can be very effective, they come with a very well-known and significant risk related to our topic today: heart failure. The risk is so well established that these drugs carry a black box warning from the FDA. That's the most serious warning that can be placed on a medication's label, and it explicitly states that glitazones can cause or worsen congestive heart failure. So, how do these diabetes drugs cause this problem? The mechanism is strikingly similar to non-steroidals, but it works through a different pathway. The primary issue is, once again, fluid retention. Glitazones act on the kidneys, causing them to reabsorb more sodium and water, which increases the volume of plasma in the bloodstream. For a patient with diabetes who is already at a higher risk for cardiovascular disease, this added fluid can be the tipping point that unmasks or worsens underlying heart failure. Imagine a dam that is already under pressure. The fluid retention caused by glitazones is like adding more water behind that dam, increasing the pressure to a critical level. The risk is significantly higher in patients who already have heart disease, are older, have chronic kidney disease, or are also taking insulin. When glitazones are used in combination with insulin, the rate of edema or swelling increases dramatically, magnifying the risk of fluid overload. If you are on a glitazone like pioglitazone or rosiglitazone, monitoring for the symptoms we discussed earlier is absolutely essential. You should be weighing yourself regularly, maybe even daily, and reporting any sudden increases to your healthcare team. So, what should you do if you are taking one of these medications? First, do not stop taking it on your own. Abruptly stopping a diabetes medication can cause your blood sugar to spike to dangerous levels. The correct approach is to partner with your doctor. Schedule a medication review to discuss the black box warning and your personal risk. Ask your doctor, given my other health conditions, am I at high risk for this side effect? Discuss if this is still the right medication for you. In recent years, newer classes of diabetes medications have been developed. Some, like SGLT2 inhibitors, have even been shown to protect the heart and be beneficial for patients with heart failure. Ask if there are safer, more modern alternatives that might be a better fit for your overall health profile. The conversation about managing your diabetes should always include a conversation about protecting your heart. I just want to reiterate this final point. Never stop a prescribed medication without consulting the doctor who prescribed it. This video is for educational purposes to empower you to have a more informed conversation. Schedule a specific medication review with your doctor. Ask targeted questions. What is my personal risk of heart failure with this drug? Are there safer alternatives for me? What lifestyle changes can I make to protect my heart? Things like reducing sodium in your diet, monitoring your weight, and keeping an eye on your blood pressure are powerful steps you can take. Being an informed patient is the most powerful tool you have for protecting your health. Thank you for taking the time to learn with me today. Stay informed and stay healthy.